together, when we're aligned as a team. We're aligned in our support of patients. We're aligned with our patients to support them. We're aligned throughout every layer of the organization so that we are all going towards the same goal and the same purpose.
My name's David Bassano, and I'm one of the co-founders and managing partners of New England Medical Group. Aligned really brings out the values of the organization.
A stands for accountability. L stands for longevity. I is integrity. G is gratitude. N, non-judgment. E, empowerment. D, dedication.
When I think about the aligned work that we do, it's a humility and an understanding between the trust we have with the clients and the folks we support, and a humility and trust with our other team members, providing layers of support so that we're getting the best outcomes for everybody involved.
As soon as people walk through the door, they're greeted with friendly, non-judgmental faces and really comprehensive services for all levels of care, getting medical support, psychiatric support, and really individualized clinical care to meet their specific needs.
The care at New England Medical Group is very individualized. We put a treatment plan together for each patient, their families. We do individual therapy, group therapy.
They really are attentive and listening and try to help them in the best way that they can, and that is something that I believe sets NEMG aside from many of the other programs in the communities.
We are the only one in the area that offers animal-assisted adolescent mental health day programming. It's really special, it's powerful and effective. A lot of people do good work and have mental health services and adult addiction services, but to have adult mental health, adult substance use, and adolescent mental health services, and a lot of other programs that are constantly being developed here really helps us serve the whole patient and the family in a very comprehensive way.
I think the most important part of treating the whole patient is we're treating everything under one roof, because sometimes it's a little scary. When you're in early recovery or you're transitioning and the fear of the unknown out there, when you feel comfortable with one organization and you're able to receive all of your services under that roof with that company you trust, it really allows the individual to grow, to have confidence, and to get all the services that they might not get if they're out on their own trying to go from one place to another.
New England Medical Group Substance Use Disorder Treatment Program for adults includes a partial hospitalization program, or PHP, an intensive outpatient program, or IOP, as well as an evening IOP program 3 nights a week to help people who want support but are still working during the day. Within that, patients have access to individualized supports through individual therapy, as well as multiple groups a day addressing substance use disorders, co-occurring mental health disorders, relapse prevention, developing coping skills so that they have all the skills and tools that they need once they complete our program to sustain their recovery in the community.
We serve folks from a diverse population. We work with adults in dedicated substance use disorder treatment. We also work with adults in dedicated mental health treatment. We also work with adolescents in a dual capacity. A lot of the adolescents that we are serving currently are struggling both with substance use disorder and primary mental health issues. And depending on the program, we have very specific clinical interventions for each one.
You know, they have that integrity and the accountability to help people. This is someplace that I would place a family member if I needed it at any point in time without a question in my mind.
We have dogs in the program every single day, anywhere from 1 to 6, all working within a very specific clinical model that is based on narrative therapy, where we can project our stories onto the animals, we can project our problems onto the animals, and we're able to have a clinical process that is less emotionally vulnerable, a more clinically profound place that we really couldn't do outside of that construct of animal-assisted psychotherapy.
To see people restore their families, to see people return back to work, the healthiest, most whole versions of themselves, it's really a beautiful thing to get to watch.
What's really exciting at New England Medical Group is we have family coaching. We have a team of people that can work with families and educate them and support them because it's a family disease. And when a person, whether they're an adult or an adolescent, is going through treatment, often the family doesn't know what to do. They have no idea how to react, how to talk, how to support. So we have a team of professionals that can really help empower the family and give them the education they need.
We have family members meet with Maureen Kavanaugh, who's our Director of Family Services and Education. And she provides firsthand experience on how to set boundaries, how to understand what your loved one is going through. It's not therapy for the family, it's more of an education for the family, which then can allow them to understand what is going on and see some of the triggers or be proactive when it comes to supporting their loved one.
The staff at New England Medical Group are the most dedicated, passionate, compassionate people that I've ever worked with. They genuinely show up to work every day, loving their job, wanting to be there, wanting to help people, and wanting to make an impact.
I think the thing I'm most proud of at New England Medical Group is the outcomes we provide for individuals and their families. The letters we receive, the accolades for our therapists that come in via emails or individualized letters saying how we've helped their son, we've helped their mother. That really, I think, touches everybody the same and really warms our heart knowing we make a difference.